are Group 4 and we will be presenting to you the Behavioral System Model by Dorothy E. Johnson. My name is Princess June Bermoy, and together with my group mates Fem, Stephanie, and Nana, we will discuss what this theory is and how it works. Are you ready? Let's get started. So, who is Dorothy E. Johnson? Dorothy E. Johnson is the nursing theorist who developed the Johnson's behavioral system model. She was born on August 21st, 1919 in Savannah, Georgia. She graduated from nursing in 1942 from Vanderbilt University of Nursing in Nashville, Tennessee. She received her master's on public health from Harvard University in Boston, Massachusetts in the year 1948. In 1968, she proposed the behavioral system model, and she stated that each individual has a patterned, purposeful, and repetitive ways of acting that comprise a behavioral system specific to that individual. Now, this theory defined that patient has 7 behavioral subsystems, and that includes affiliative, dependency, ingestive, eliminative, aggressive, and achievement. Now, later on, nurses think that it's not enough, and so they added one more subsystem, which is the restorative. Let's hear from Fem about the different assumptions of the behavioral system model.
I'm going to discuss the assumption of the behavioral system model. The assumption made by Dorothy Johnson fall into 3 categories: the assumptions about the system, the assumptions about the structure, and the assumptions about the function. Assumptions about the system. Johnson identified several assumptions that are critical to understanding the nature and operation of the person as a behavioral system. First, the system that is composed of organization, interaction, interdependency, and integration of the parts and elements of the behaviors. Second, system that tends to achieve a balance among the various forces operating within and upon it, and that men strive continually to maintain a behavioral system balance and a steady state by more or less autonomic adjustment. Third, a behavioral system which requires and result in some degree of regularity and constancy in behavior is essential to man. It is a functionally significant because it serves as a useful purpose in social life as well as for the individual. Fourth, system balance reflects adjustment and adaptation that are successful in some way and to some degree. There are also 4 assumptions about the structures and function of each subsystem, from the form the behavior takes and the consequences it achieves can be interfered, what drive has been stimulated, or what goal is being sought. Each individual has a predisposition to act with preference to the goal in certain ways rather than the other ways, which is called a set. Each subsystem has a range of choices called a scope of action. Finally, it produces an observable outcome, which is the patient's behavior.
Hi everyone, I'm Stephanie Mosquera. Today, I'm going to discuss about the major concepts of the theory. There are 4 major concepts of the theory. The first one is human being, as having 2 major systems, the biological system and the behavioral system. It is the role of medicine to focus on biological system, whereas nursing focuses the behavioral system. Second is society. It relates to the environment on which the individual exists. According to Johnson, an individual's behavior is influenced by the events in the environment. The third is health. It's a focused adaptive response physically, mentally, emotionally, and socially to internal and external stimuli in order to maintain stability and comfort. The last one is nursing. Has a primary goal is to focus equilibrium within the individual. Nursing is concerned with organized and integrated whole, but the major focus is on maintaining a balance in the behavioral system when illness occurs in an individual. A mini system with its own particular goal and function that can be maintained as long as its relationship to the other subsystem or the environment is not disturbed. There are 8 subsystems. The first one is attachment affiliative subsystem. It is probably the most critical because it forms the basis for all social organization. Second is dependency subsystem. It promotes helping behavior that calls for a nurturing response. Third is ingestive subsystem. It should not be seen as input and output mechanism of the system. Fourth one is eliminative subsystem. It addresses when, how, and under what condition we eliminate. Fifth is sexual subsystem. It has a dual functions of procreation and gratification. Achievement subsystem. It attempts to manipulate the environment. Aggressive protective subsystem. The function is protection and preservation. The last one is equilibrium. It stated that equilibrium is the key concept in nursing specific goal. It defines a stabilized but more or less transitory resting state in which the individual is harmony with himself and with the environment.
Hi guys, I'm Nena. I'll be talking about Dorothy Johnson's model in the 21st century in nursing practice. First of all, it's divided into strengths and weaknesses. So Dorothy Johnson's theory guides nursing practice, education, and research, and it generates new ideas about nursing and differentiates nursing from other health professionals. It has been used in inpatient and outpatient and community settings, as well as in the nursing administration. It has always been used for nursing education and has always been used in practice and in institutions and different parts of the world. Another advantage of this model is that it provides framework of reference for nursing concerned with specific client behaviors. It can also be generalized across lifespan and across cultures. The weaknesses of this model is that the theory is potentially complex because there are several possible interrelationships among the behavioral system, in subsystem and environment. Potential relationships have been explored, but more empirical work is needed. The theory is used extensively with people who are ill or faced with threat or illness. However, it is used with families, groups, and communities is limited. Though the 7 subsystems identified by Johnson are said to be open, linked, and interrelated, there were a lack of clear definitions for the interrelationship among them, which makes it difficult to view the entire behavioral system as an entity. The problem involving interrelationships among the concept also creates difficulty in the following work of Dorothy Johnson. Thank you.
Our case is Mrs. Susan Smith, 42 years old female, was admitted 3 days ago due to severe abdominal pain and distension. Ultrasound, MRI, X-ray, and blood works were done, and the results showed stage 3A ovarian cancer. The cancer has spread to the lymph nodes in the back of the abdomen, which is the retroperitoneal lymph nodes. During the assessment, past history revealed that the patient's mother died of breast cancer 5 years ago. Her last pap smear was 3 years ago, and she has not gone to the doctor since. She is 5 feet 5 inches tall and weighs 130 pounds. She has a history of smoking of 1 pack of cigarettes a day for the past 15 years. She is Gravida 2, Para 2. She is working as an accounting manager in a big accounting firm, and she has been married for 20 years and describes her husband as jobless and an irresponsible partner and father to their children who are aged 7 and 12. They are currently living with their mother-in-law, and she described to be very strict, and she always has a disagreement with her, telling that her mother-in-law hates her. She can't sleep well due to pain, and she is expressing concern about the future of her family without her being around. She's not feeling herself lately. She easily gets irritated and angry. Mrs. Smith is scheduled for a total hysterectomy, bilateral salpingo-oophorectomy, and omentectomy. She will also receive radiation therapy after the surgery. She is currently being given analgesics for her pain. Based on the theoretical framework of the Johnson's behavioral system model, we were able to assess the patient and gathered some data to help establish client goals in nursing care plans. We were able to come up with some plans on how to intervene the patient, and we evaluated it and concluded thereafter. For the assessment, we divided into two, the subjective and the objective. For the subjective, the patient have complained of severe abdominal pain with pain scale of 9 out of 10. She have also mentioned the feeling of fullness even after eating small meals, bloating, and loss of appetite. She experienced painful sexual intercourse and vaginal bleeding. For the objective, the patient's abdomen is distended and she looks very pale. Her hands and her feet are cool to touch. Her vital signs are BP of 120/70, temperature of 37.5 degrees Celsius, pulse rate of 80 beats per minute, respiration of 22 BPM. Laboratory results shows that the hemoglobin is 10 grams per liter, RBC of 2.5 millions per microliter. Ultrasound, MRI, and X-ray confirm the extension of the cancer cells spreading to the back of her abdomen. For the behavioral assessment under the 8 subsystems, under achievement, Mrs. Smith is working as an accounting manager in a huge accounting firm, and she is worried that she may not be able to go back to work after her surgery, and that creates a problem of in terms of providing for her family. Now, in this case, there is a possible loss of the ability to achieve the developmental milestone for the middle adulthood. Under the affiliative, Mrs. Smith's relationship with her mother-in-law is not healthy. They are always arguing, and it is giving her so much stress. And her emotional endurance is possibly impaired because of this. The aggressive and protective Mrs. Smith has been focusing so much on her work that she have forgotten about her health. Now, she does not comply to any annual physical exam, even her pap smear, which should be done every 2 years, and she has been smoking for 15 years. There is a possible knowledge deficit on her case, and as well as especially on the smoking cessation. For dependency, she is the breadwinner of her family, and everyone is depending on her and on her job. And now that she cannot work, she's currently the one depending, especially on her mother-in-law, and that gives her a low self-esteem because of her situation. And just she has complained feeling of fullness and bloated after eating small meals. For eliminative, she urinates more frequently, and she started noticing vaginal discharge as well as vaginal bleeding. Sexual, she complained about having painful sexual intercourse with her husband. For restorative, she is experiencing sleep disturbances due to pain and stress.
Going to discuss the nursing interventions and rationale using the theory of Dorothy Johnson's. For the achievement, give positive reinforcement and motivation to live like talking about her children and family. Rationale to enhance patients' cooperation. Next, provide information to support about self-efficacy and self-management by focusing on problem solving and decision making. Rationale, educational programs based on empowerment have demonstrated effectiveness. Next, emotional reassurance like counseling. Rationale to provide emotional outlet and help patient cope up from fears. Next, teach patient relaxation techniques. rationality to distract attention and to reduce tension. To affiliative, doctor has been about the importance of the patient's stress-free environment, rationality to avoid stress for the client or to the patients. Next is determine how she handled her problem with her mother-in-law before in a positive way, rationality to identify a positive way that can be used to resolve in current situation. For the aggressive and protective, um, verbally acknowledge her absence of not complying her annual physical checkup and pap test. Rationally acknowledge the patient's absence was noticed may reinforce the patient's feelings and self-worth. Next, explain disease process, procedures, and events in concise manner. Rationally is may help the patient to express emotion, grasp situation, and feel more control. Next is smoking cessation. Rationally, smoking might prevent the body immune system from effectively fighting HPV. For dependency, present referral information about community resources, support group, and professional counseling. Rationally, professional and community sources of support provide the patient with more resources to sustain the work of rebuilding positive self-esteem. For ingestive, abdominal assessment, check for bowel sounds and distension. Rationally to check for bowel sounds and distension or masses. Um, Next is instructed and encourage patient and appropriate balanced diet, more on fiber and bulk. Rationally to improve consistency of stool and facilitate passage through colon. For eliminative, monitor and record patients' vital signs, intake and output, and daily weight. Rationally to have a baseline data and monitor signs of dehydration. Encourage fluid intake to 3000 ml a day unless contraindicated. Rationally, it flushes kidney uh, or bladder of bacteria but may result in water intoxication. Fluid overload if not monitored closely. Next is recommended restrictions of caffeine, rationally to reduce effects of diuresis. Next is check the color, frequency, amount, and consistency of urine. For example, bright red with red clot. Rationally usually indicate arterial bleeding that require aggressive therapy. Next is check vaginal bleeding, rationally sudden, heavy or vaginal bleeding that soaks one pad every hour for 24 hours need to be reported to the physician immediately. Next is monitor CBC to check anemia, rationally that is useful in evaluating blood losses and replacement if needed. Next is regulated IBF level D5LR accurately, rationally necessary for fluid volume replacement. For the sexual, allow patient to express feelings openly in non-judgmental atmosphere, rationally to enhance communication, provide answers to a specific question, rationally it helps patient to focus on specific issues, clarify misconception, and build trust. Next, offer her a material to read that contain information of cervical cancer, its side effect that may cause various physical, psychological, sexual, and reproductive problems. Rationally knowledge help to deal with fear and allow patient to deal with the reality. Next is provide here information about numerous relaxation and other exercises for improving sexual fitness such as Kegel exercise, sensation focus exercise, and exercise of various technical positions during sexual intercourse. Rationally to provide adequate knowledge on the patient. For restorative, administer pain medication, rationally to help manage the pain and promote sleep. Next is introduce relaxing activities such as a warm bath, calm music, reading book, and relaxation exercise before bedtime. Rationally, these activities provide relaxation and distraction to prepare mind and body for sleep. Next is provide quiet environment to enhance relaxation. Next is educate about the importance of sleep requirements. Rationally, at least 6 hours of sleep for normal memory and brain function.
I am
decrease pain and to have a sufficient or uninterrupted sleep, to decrease anxiety and cope with situational matter, to enhance family relationships that enable emotional support, to comply with physical checkup and regularly visit the physician, to gain knowledge about how to avoid smoking, to gather data for organizational support or programs assisting families needing financial support.
So, for client evaluation, there's increased emotional support for the family. The client feel more safe and comfortable. Healthcare providers continues care. She controls her pain with relaxation imagery techniques, requiring only occasional analgesics. She seems optimistic and she quit smoking. She and her family have continued to attend the cancer support group meetings. She is planning for the future and has talked with her family about what it means to live with cancer. In conclusion, it will help the client cope up with the emotional stress caused by health, family, and financial problems. Behavioral theory model enhances emotional well-being and social support. As of the nurse's point of view, it will help the nurse understand the client behavior and know what to expect and how to manage it. Thank you and have a good day.
And that is the behavioral system model by Dorothy E. Johnson. We thank you all so much and we hope that you have enjoyed our presentation and that you have learned something from it. Again, we are group 4 and please let us know if you do have any questions. Have a great day.